OT Lifehacker here with peripheral nervous system neuromuscular diseases. Welcome to our growing channel. OT Lifehacker is all about occupational therapy and positivity. And in today's video, we're going to go over ALS, Erb's palsy, Klumpke's palsy, Guillain-Barre syndrome, Myasthenia Gravis, and Post-Polio syndrome. So if you are in occupational therapy, speech therapy, physical therapy, nursing, if you are preparing for your exam, the board licensing exam, this can be a very helpful video for you because we are going to break down these different diseases and give you mnemonics that I've been using for myself to help study. Alright, so let's get started. ALS, Amyotrophic lateral sclerosis. I remember this as Amy lost strength. So for the ALS, I use my synonym is Amy lost strength. Why she lost strength is because of degeneration of the corticospinal tract. The corticospinal tract is responsible for voluntary movement. So degeneration of this results in decreased handwriting, the ability to cut food, dress, hygiene, walk, do stairs, speech, swallow, respiratory insufficiencies, salivation, dysfunction, and dyspnea, which is shortness of breath. And orthopnea is discomfort in breathing when lying flat. In my acronym Amy lost strength, the strength part comes from the anterior horn cells, which is part of the corticospinal tract. So these anterior horn cells, I remember them as motor by anterior. The word I associate with it is act, and act is, in order to act, your motor function needs to be well working. And so Amy lost strength because her anterior horn cells were not working properly, and so she had decreased muscle strength, leading to muscle weakness and atrophy. Treatment for amyotrophic lateral sclerosis includes prevent aspiration, such as with a modified diet, pain management, prevent contractures, and spasticity. Next is Erb's palsy. I study this as elbow and paralysis. So again, EP, I turn that into elbow and paralysis. Why? Is because Erb's palsy leads to paralysis of the upper brachial plexus, the 5th, 6th, and possibly 7th cervical nerves. This causes paralysis of the supraspinatus, infraspinatus, deltoid, biceps, brachialis, and subscapularis. There is elbow flexion weakness. The person cannot raise their arm. They will have a weak retraction and protraction of the scapula. Treatment would include positioning, range of motion to retain the external rotation, abduction, and flexion of the shoulder. Now, Klumpke's palsy is paralysis of the lower brachial plexus, C7, 8, and the first thoracic nerve. How I remember this is hand clumped up. So for Klumpke's, I think of clumped. And since it's a lower area, that would include the hand clumped up. So it's paralysis of hand and wrist and fingers. Often it's associated with ipsilateral Horner syndrome. Then we have Guillain-Barre syndrome, and for GB, I think of get buff. Because this results in the opposite. With Guillain-Barre syndrome, the person has symmetrical muscle weakness and minor sensory symptoms, which includes pain in the extremities. There is possible respiratory failure and dysphagia. Now, myasthenia gravis. I think of this as my acetylcholine. So it is an attack on my acetylcholine. Acetylcholine is a neurotransmitter that contracts smooth muscles, and the smooth muscles are involuntary muscles. So when I think of my acetylcholine, I think of my body is being attacked, my involuntary muscles are being attacked, which leads us to muscle weakness and fatigue of the eye, mouth, and limbs. So eye, you'll see drooping of the upper eyelid and double vision. For the mouth, you experience slurred speech, difficulty swallowing. And for limb, there will be proximal limb weakness, which can lead to quadriparesis. Quadriparesis is weakness in all four limbs, the arms and legs. And MG, Myasthenia Gravis, can also result in life-threatening respiratory muscle weakness. Last is Post-Polio syndrome. And how I see this is PPS. P for paralyzed, and paralyzed are the paralyzed muscles, and it can be new fatigue, weakness, weak muscles because of the axon sprout degeneration, which allows for movement. It can result in muscle and joint pain, atrophy, loss of functional skills, and cold intolerance. Then we have PACE and splint, the last P and last S. So PACE and splint are more for treatment. The treatment also includes, along with PACE and splint or orthoses, treatment includes exercise and stretching. Alright guys, that is everything for today. Please do like and subscribe once again, and find me on Instagram at @OT_lifehacker. If you have mnemonics, study strategies that you use to remember, understand all of this, please do share it in the comments below with everyone else.